Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Sandy and I am the Executive Officer of the Association and a cancer survivor.
And my name is Malcolm, a former surgeon and presently Chairman of the Isle of Man Anti-Cancer Association. In this podcast we want to talk a little about lumps. Lumps are probably the commonest reason for someone going to their GP concerned that they might have cancer, often saying to their GP, "I found a lump," in a rather worrying tone. Although it is important to remember that most lumps are not cancerous, you should still seek medical advice if you find a new lump that does not disappear over 3 to 4 weeks.
Most individuals will already have a variety of lumps on or under their skin, and a number may even be visible and recognisable to relatives, friends or even work colleagues. Unfortunately, this can sometimes make us complacent, so that when a new lump appears, we may be slow to realise its true nature. Remember, cancers start from a single abnormal cell which divides repeatedly to form a tumour. The smaller the lump or tumour at the time it is diagnosed, the easier it is to remove and the less chance it has to spread, and the better your chances that disease will not come back.
So where should we be looking for new lumps which may harm us? Lumps can occur all over and within our bodies. Areas that we should be looking at in particular are on or under the skin generally, in the neck, the breast tissue in ladies and men, and the scrotum in men. Let's start by talking about concerning lumps on the skin. Although most skin cancers present as lumps on parts of our body exposed to sunlight, they can also occur elsewhere. They may look like a smooth, pearly-edged ulcer which bleeds and never seems to quite heal, known as a rodent ulcer or basal cell carcinoma, or a crusted lump that slowly gets bigger, known as a squamous cell carcinoma. Of more concern, though, to most of us, is the mole. Everyone has moles, small pigmented spots, fairly evenly coloured, with a smooth rim that changes very little. For the sinister mole or malignant melanoma, think A, B, C, D, E. A for asymmetry of shape, B for a border which is irregular, C for colour, usually mixed with lighter and darker areas, D diameter more than 7 millimeters in size, and E for evolving, that is changing in colour, size or shape, and it may also itch or bleed.
There are also concerning lumps which arise under the skin, particularly in the neck, under the armpits and in the groins. There are a lot of lymph glands in these areas which can swell and become tender with infections. These can feel like beans that can often be moved around or underneath the skin. These same glands can also harbour cancers in some individuals.
Men should regularly examine their scrotum, also often known as the ball sack, for lumps. There are a number of simple benign types of lumps that arise in the scrotum, but the lump that is the most concerning and may be a tumour is a lump that involves one of the testicles, which is nearly always painless, though sometimes associated with a dragging sensation in the scrotum. Remember, the good Lord gave us two of most things, so comparing one side with the other can be helpful.
Ladies should also examine their breasts regularly for lumps. Again, there are many different types of benign lumps or cysts that arise in the breast, often in a cyclical pattern just prior to menstruation, which can sometimes make individuals complacent when a more sinister lesion develops. When examining your breast, remember TLC. Touch your breast. Can you feel anything unusual? Look for changes. Is there any change in shape or texture of the breast? Check anything unusual with your doctor or a practice nurse. There are a number of websites that can guide you through how to examine your breasts. And remember, men can also develop breast cancer. Where there is a nipple, there is some breast tissue, however small, behind it.
We've talked about how and what to look for, but how often and when should we examine things, and what should we do if we feel there is something not right? A good rule is to look and examine yourself every 3 to 4 weeks, perhaps once a month with a regular date recorded on the calendar or in your diary. It is often best done after a bath or shower when the skin and tissues are warm and supple. If you notice a new skin lesion, you might like to take a photograph of it on your mobile phone for comparison in a couple of weeks. There may be difficult parts for you to examine yourself, and a spouse or partner can help. If you find anything new, as we always say, get it checked out by your doctor or practice nurse.
If you want more information about various lumps that may be cancerous, you can visit the Macmillan Cancer Information Centre by phone on 650735 or visit their website at macmillan.org.uk. Another useful site is cancerresearch.org.uk. There are also a number of very good websites dealing with specific tumour areas, for example, breastcancernow.org, that can be found through the search engine on your mobile phone or computer. Thank you so much for listening.